students? So here we are to learn about the very important instrument what we are going to use in the emergency setting. It is not in a casual setting, it is in an emergency setting. Where what are the things we consider as an emergency? What are the things you have seen as an emergency? That is priority based. What are the things? We go with A, B, C like that. What is A? Airway. B, breathing. C goes for suffocation or compressions. Okay. So you are seeing somebody who is lying down in the market. Okay. So when you see somebody unconscious lying down in the market, what is the first thing you will do? Assess the patient. Very good. How you will assess the patient? Tap the patient to see whether the patient is conscious or not. Okay, very good. Any other points? Check the carotid pulse. You will see whether the patient is alive. Okay, then check for the carotid pulse. Another thing is Akash, what you will be doing again? Breathe. You need to go in for check the breathing, whether the patient is breathing. Either you can assess with the feel for the air entry near the nose, or you will be going and seeing the look, listen, feel concept. Okay, what is that? Look, listen and feel. Look for the rise and fall of the chest wall movement. Listen for the air entry sounds and feel the air entry. If we are going near the patient and keeping, if the patient is breathing, we can find out whether the air is getting in and coming out. So the air movement can be felt with the examiners or my sheet. Okay, I can feel the air entry in my face. So we see that patient is unconscious, patient is not breathing, patient is lying still. You can check the carotid pulse and find out whether the patient is having carotid pulse. So in this situation, we will be providing a compression, and we will be giving a breathing technique. That is what we call it as cardiopulmonary resuscitation. That is CPR given in a common setting, okay, in a non-hospital setting also. If the same thing happens in a hospital, how we need to provide the things, how we need to provide a CPR. If in a community setting, we will give compressions, and breathing how we will give? Either by mouth to mouth respiration or by mouth to nose respiration. Mouth to nose or mouth to mouth breathing. Okay. So if it is in a hospital setting, we know that the hospital have the oxygen supply and on the all other emergency equipments at the bedside or in the reachable vicinity. Yes or no? So you can, every ward has a crash cart. Every hospital has a code blue team. So and every ward has a instrument like this. Have you seen what is this instrument? Ambu bag. Yes, this is what it is called as ambu bag. So what is ambu bag? What is AMBU? It is all caps. Okay, all in capital letter. AMBU is ambu. That is artificial. Artificial manual. What we are going to do something with this. So it is manual breathing unit. With this unit, we are going to provide breathing for this unconscious patient. You understand? So when we have this ambu bag, so there are parts with this ambu. What is that? This is the face mask. Can you see this is a hard part over here? Yes. This is a fiber part, and this is a flexible one. Can you see this flexibility of the mask? Yes. It will give a. This is made up of silicone, so it will give a more flexibility and it will have a more tight conceal to prevent air leak. Okay. So when we keep this, so we will be able to provide a airtight seal. So this is the silicone part, and here you have the fiber part. Next it will be the valve, pressure valve. Okay. So this will be a connecting tube, and this will be the breathing unit, or it is a self-inflatable unit. Okay. So you have this, and here you have a small hole. Can you see this one? This will be connected to the oxygen flow meter or oxygen source. This is the inlet. So you have this bag-like structure which is called as a reservoir bag. So this reservoir bag can hold 2.6 liters. That is 2600 ml. This of air can be reserved in this place. Okay. So this is what it is. The ambu bag means. So the ambu means artificial manual breathing unit. You have the silicone backbone mask and the fiber mask outer area, pressure valve and connecting tube, inflatable unit. You have the inlet tube present over here where you can connect to the oxygen source. This will be the reservoir bag. This reservoir bag has 2.6 liters capacity of air can be filled. So can any one of you tell me the parts of this ambu bag? Hold it in hand and tell me. Yes, Akash? Good. Tell me. Yes, face mask for the patient. Good. Silicone. Inlet, oxygen inlet tubing. Okay. You can read it from this also. Here it is being given what is this quantity. Okay. So this is the oxygen reservoir bag with 2600 ml. Okay. Non-autoclavable cold sterilized. Okay. So how we will keep this? We will be keeping this. Which part will go in the top? Silicone, that is the sharper end. Sharper end will be over the nose and the longer end will be in the chin. Okay, which will be covering the nose and chin. So when you hold, what you will do? You will hold the C and E position. Ammu, what is the position? C and E position. This will be the C position. Your two fingers will hold in a C shaped position and you will be putting this three fingers to lift up the chin and hold this airway tight. So you will be opening up the airway. Okay. So C and E position. What is this? Where is the C position?
The two fingers.
Two fingers are the C position and E position is this one. Yes. Can Ammu show me the C and E position?
Tightening
Okay.
in the upward position and fixing C position in here and E position.
C position some more closer, tighter. Yes. Okay.
And E position and to chin upward.
Lift the chin upward. Very good. So how difficult it is to hold this? Is it easy to hold an ambu bag? No. It needs practice. It needs repeated practice. You need to hold properly and tight also, like this. Okay. Now is it okay? C question, E question, Akshay? Oh. Anybody wants to hold and see? Yes. Okay. Yes. 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 You can see the C position here and three fingers in the E position. So this is the proper way of holding and using how to use the ambu bag. Okay. Thank you all. Any doubts you can ask me. So when you have free time, take this ambu bag, hold it and try to practice.